Today we are going to see the procedures of PNF. This will be a two-part class. In the first part, I'm going to tell you what are the procedures, and in the second part, which I'll be taking in a further class, it will be predominantly on the practical aspects of how do we normally execute it. Now, you can see that there are many procedures of PNF, and these include manual contact, stretch, traction and approximation, vision and verbal commands, body position mechanics, overflow, and patterns. So, what's a manual contact? Normally, whenever we are going to try and stimulate the person, there are many receptors in the skin which will be facilitated when you apply your hand over the body part. Say for example, in the last class we saw that there are multiple patterns and there is a pattern called D1 pattern. So in a D1 pattern, therapist will normally give resistance to the movement, but he'll be holding the arm. So when he is holding the arm, the information from the skin receptors will be going on to the spinal cord, and that will act as a stimulus to the muscles which are directly under them. So if you're going to do a D1 flexion pattern, then you should be resisting the D1 flexion pattern, which is opposite to that. So your hands will normally be placed on the flexor aspects of it, because it's a flexion pattern you're going to resist. So the direction of motion will be, and the hand contact will be opposite. Okay. Next, we all know that when a muscle is stretched to the maximum, it will be in a good position to contract. Right? So what happens is, whenever your muscle is stretched, you have muscle spindles inside the muscle, and these will also be stretched. A muscle spindle gives an input to the spinal cord in the form of excitatory impulses. So I want you to recall at this point of time that we had been looking into the basic neurophysiological principles, that there is a principle called summation. So previously I told manual contact, now the muscle stretch. These both the impulses, when given at the same time, can go and act together. That's how it's going to work. So how do we stretch it? Before starting anything, any pattern, we normally keep the muscles in the exactly opposite pattern. So if you're going to do a D1 flexion pattern, you'll be keeping it in an exactly opposite position, and in this position all the muscles will be elongated, right? So our idea is to keep the muscle elongated, and once this elongation position is attained, what we do is, before starting of the resisted movement, we normally give a stretch to all the muscles. Basically we pull them so that there is a stretch, and then it will be, along with that, we will ask them to contract. So the primary idea you need to understand is, whenever we are going to give a PNF, the second principle we use is, we stretch the muscles, put them in elongated position, further stretch it before starting the movement or the exercise. The next principle is traction. Now what is a traction? Traction, as all of you know, is giving a pulling force to it. So what we can have is, whenever you're going to initiate a PNF pattern, we have previously told that we'll be keeping all the muscles and joints in an elongated position. So in this position, whenever we are giving movement, we initiate it with traction. Now how do we do that? We use our body weight and we pull the distal part of the limb in order to give a traction. Now how does a traction actually help? Now we need to understand that whenever you are going to have a say you're going to use your upper limb and your flexors, right? In normal day-to-day activities, we will know that whenever we are standing, our arms are always down and they are all pulled down, right? So the gravity is exactly acting down, and so our hands are all in a relaxed position down. Clear? So it's an elongation. So now what we are doing with elongation is we are just increasing that so that the pulling force is higher. And whenever we do most of the action in upper limb, we will tend to, you lift any object, you are going to get into a flexion. So the traction force is a precursor, or it comes normally in the upper limb before you do any movement which you are going to exert a lot of force and pull it. Okay, right? So how do we give a traction? We just keep the arm in the extended position and we just pull it. That's how we give a traction. Now, you should understand very clearly that traction is given in order to facilitate the flexor group of muscles. So even if you are going to give for a lower limb, if you go with a D1 flexion pattern or a D2 flexion pattern, then customarily we will be giving a traction. Now, these traction stimulates the receptors. They tell, that is the originators of PNF, they claim that there are multiple receptors within the joints, and these receptors, which are located both within the joint and in the capsules, are stimulated when you give a traction. So this additionally sends inputs to your spinal cord along with the previous two stimulus, that is your manual contact and stretch, and adds along with that and stimulates the muscle better. Now, next one is approximation. Approximation basically is opposite of traction, where you compress an extremity. You compress an extremity. So when do we give approximation? Whenever we want facilitation of the extensor group of muscles, we give approximation. Now, why is it so? Now, before seeing why is it so, how does this act? How it acts is, whenever you're going to give an approximation, the receptors within the joint will all be compressed. So they will send impulses to the spinal cord, and that can act in order to facilitate the muscles. Now, why specifically extensors? The reason being, if you think about as our normal regular posture, whenever we are in a standing posture, our joints are all approximated in the lower limb. Correct? Your hip, your knee, all are loaded. So they are all compressed normally. So when you are standing, concomitantly when this compression is going on, we also see that our muscles predominantly are extensors, our gluteus maximus, our quadriceps, and our plantar flexors are predominantly active. So within the brain, there is always a training that whenever we are going to go for a contraction of the extensor group of muscles, it normally is associated with approximation of the joints. So this patterning might be present within the brain, and therefore the originators of PNF, Herman Kabat and not, they proposed that we can add approximation along with facilitating the muscles whenever our aim is to facilitate the extensors. So if you are going to do a D1 extension pattern or a D2 extension pattern of upper limb or lower limb, try to give a compression before starting off it. And we also saw previously that we give a traction in order to facilitate the flexor muscles, and approximation is basically we apply a joint compression before starting of the movement, not to facilitate the extensor muscle. The next is vision. Now, where should the patient be looking? Now, whenever we normally what happens is we can give the PNF in multiple positions, but predominantly since the patient will not be able to move, we might be giving them predominantly in a lying posture. When we are giving it in a lying posture, it is normal that the patient will be looking straight rather than looking into the joints and which movements are happening. But what happens is when you're doing joint movements, when you look into it, the movements and how much movement is exactly happening and how much is furthermore required, this information will be more clearer to the brain. If you close your eyes and move, rather if you open your eyes and move, you will be more confident in that, and your brain also can pick up these information. Although these inputs will not directly go and stimulate the spinal cord, these inputs are going to help in producing better movements, and so greater activation of the muscles can be expected with vision. Now, next we go to verbal command. Now, before going to the verbal command, we would like to look upon what we have covered till now. Sorry for the disturbance. We will be looking into what we have covered till now. We have covered four things. One is manual contact, second one is stretch, and then we had looked into traction approximation, and then finally we also looked into vision. And now all these ones are to be applied on the patient by the therapist, and vision is about what the patient is going to do during the time of applying a PNF. Now the next one is we are going to look into verbal command. Now this is there are a few more things which a therapist will apply, but they are additional, but so we will primarily do verbal command. In giving a verbal command, we need to be very clear to the patient what they ought to do, and the volume of the verbal command also matters. So step number one is the commands can be given during three steps: preparation command, action command, and correction command. Now, what is a preparation command? Preparation command is one where we are going to make the patient ready for generating an action. We primarily, when you do a PNF, it's a slightly complicated exercise in terms of the patient, because multiple joints are involved and multiple movements are involved. So the patient needs to be taught by making the movements 2 or 3 times before that in order to familiarize with him, and then we have to start. Now, why is preparation command very important? We saw in one of the previous presentation that timing is very important. So what happens is when you start giving a PNF, you move on very fast. 1, 2, 3. Next stimulus you will be adding manual contact. You will next be adding a stretch, and immediately the patient has to start contracting. So what happens is the patient needs to be ready, and then he has to add. So then everything will be going on within a small span of time, and we will collect it. So that's why we need to give a preparation command. Usually it's a very short command. Now this is the command we give. The command is now, so that they are getting ready. You can give any command, it needs to be cued, and they need to understand that's a cue that they need to start. Next is action command. So in which direction the patient has to move, which joints he has to concentrate more, where he has to pull in, this command has to be given. Again, this command has to be very short for the patient to get it and start doing it. So for example, action command during a D1 flexion could be, now flex your wrist. That could be one of the action commands. So we expect the patient to flex the wrist during this time. When half of the movement is going on, we ask him to do now emphasis more on the shoulder, right? It could be like that. So it depends on the purpose. We will look into that later. But this is called as an action command. What are the actions that we want the patient to do while the PNF procedure is going on? Lastly, in verbal command is a correction command. So whenever you give, the patient might be making a mistake. He might not be moving a joint through the range which he has to move, or he might be generating less force from a certain joint and more force from other joint. So we need to correct him. So we will be telling him, now try and complete this movement more, or we'll be telling him you need to reduce the amount of activity. Now, a very important thing is all these commands have to be in a language which the patient understands. So you cannot be telling now do D1 flexion pattern. What you need to tell, now try to pull me. That is the command you'll have to tell. Next, from the therapist point of view, is body position. Normally the therapist will have to stand in an inclined position to the patient's body. We will not be standing exactly in front, or will not be standing exactly on the side, because most of the movement has a rotation component or a diagonal component. So we saw that in the last class. It's a movement which starts laterally and then goes on medially, but it doesn't go straight. It goes from down to up. So the directional movement, say for example a D1 flexion pattern, it will be starting from near your hip for the upper limb. For the upper limb, it will be starting by having your hand closer to the hip, and it will be ending when your hand is closer to your other shoulder. So the line of movement is from the hip joint to the shoulder joint. So that is the line which is connecting. So we need to be standing in that line. Then only it will be easier for us to actually perform the command perform the movement and resist the movement very good. If you're standing on the lateral, the amount of resistance which you will be able to give, and hence the ability to control the movement will be very less. Right? So the body mechanics of the patient is very important. So in addition to giving a resistance, we also need to feel where the movements are high, where the movements are low, which muscles are activating more, which muscles are less, and we need to correct those using our hands. Yeah. So lastly, we are going to look into overflow. During a previous class, I told you how we give a principle of overflow. I told you an example where you resist your neck movements, but your abdominal muscles will be increasing its activity. Similarly, here we can facilitate using resistance. So what we do is, whenever we want good movement from one particular joint, we immediately select the nearby joint. Now this nearby joint could be a distal joint or a proximal joint. For example, you want to facilitate elbow flexors, you can facilitate it by giving a lot of resistance to wrist flexors or to shoulder flexors. Now these joints from which we are going to give the overflow is called as a pivot. Okay, so those joints are called as pivot. So we need to select a pivot and we resist it more. So once we resist it more, the contraction will overflow to the other joint and we'll be getting maximum contraction during this. So all these procedures we'll be doing alongside the patterns of movement which we have previously seen in the last class. Thank you for listening to this short presentation on procedures of PNF. We'll be having a practical demonstration of this, and we will try to do it in the next class, how we are going to incorporate each of this into our repertoire of PNF capabilities. Thank you.